Hi.
Hi, Mr. Russo.
Yeah.
Hi, my name's Erin. I'm gonna be the nurse practitioner for you today. And I'm here to perform a head, eye, ear, nose, and throat exam
Great.
for a new 650 in my assessment course. And I just wanted to get permission from you before
You
we
got it.
proceeded. Excellent. I give permission for this recording as well. So I'm just gonna begin by washing my hands before we get started. How are you doing?
Very well.
Great. Any concerns you have about any of this head, eye, ear, nose?
Just my eyes are all red from winter.
Really?
Yeah,
Are you doing anything for it?
just a moisturizer.
Okay, anything that's been prescribed,
No.
something you bought over the
Oh, the
counter?
kind of stuff.
Do you remember the name of what
No
you're
idea.
using? And does it appear to be helping you?
Yeah, it's great.
You can see it's a little excoriated, a little flaking a
Mhm.
little bit. All right, and do you wear contacts or glasses?
Contacts.
Contacts, and are you nearsighted, farsighted?
Nearsighted.
Okay, all right. And do they help? Do you have any concerns about your vision? All right, any other concerns today?
Not at all.
All right, so I'm just gonna begin by doing a general examination of your head and neck. Everything looks symmetric, nice and equal, normocephalic, nothing seems out of range, and I noticed some pattern baldness.
Lucky.
Anything unusual, or has this been the same
I've
for
been
you?
bald for a long time.
Okay, all right, great. And any other concerns about skin lesions,
No.
skin breakdown? I'm noticing a little redness over here with some eczema too. Okay, all right. Has that spread for you?
No.
All right, so it's been the same, better at all with the
She had
lotion?
lotion makes it better.
Okay, all right. So now I'm just gonna begin by looking at your general range of motion of your neck. So I'm gonna go ahead and have you move your head to the left for me and to the right. Right, and up and down. Any pain or discomfort
None.
at all? Okay, all right, so the next part I'm gonna do is I'm gonna have you go ahead and just push against my hand when I push. Right, excellent strength. And this side. And push down. Okay, and push up. Right, great. Any discomfort or pain when you do that at all? All right. And I've noticed the eczema on your eyelids, but I'm going to just take a good look at your inside your eyes. So I apologize if I cause you a little discomfort, but I'm going to first of all begin by pulling down on your eyelids, and I'm going to have you look up when I do that. Okay, ready? All right, your sclera look nice and clear, no redness, no ulcerations inside the eyelids. Now I'm gonna have you look down as I pull up. Again, forgive me if I got you a little discomfort. I know they look sore. But again, your sclera look nice and clear, no lesions, no bleeding, no concerns about your vasculature. All right, now I'm gonna go ahead and I'm just gonna shine a light under your pupils. I just want to make sure that they're reactive to light and there's no concerns about any nystagmus or anything like that. All right, great, thank you so much. So we'll begin. I'm just going to look, I'm going to get a little close when I do this just because I need to be able to look inside your pupil. All right, ready? All right, everything looks great. Excellent. Now I'm going to look at your left side. And everything looks great. Your pupils are equal and reactive to light. So that is fantastic. And now I'm just going to have you follow my light with your eyes. Okay, but do not move your head. All right, ready?
Yep.
Okay, excellent. The next step is I'm just going to make sure that you have visual acuity. So I'm going to take my fingers from behind your head and I want you to let me know when you see them.
Yep. Yep. And yeah,
Okay, great. So no concerns with driving. You seem to have some good visual acuity. All right. And the next step in the examination is to examine your ears. Have you noticed any concerns with drainage,
Nope.
any loss of hearing, any pain at all? All right. So I'm gonna take my otoscope and we're gonna go ahead and take a peek inside your right ear first. I'm gonna try to be as gentle as possible, but bear with me as I go from this side. I'm gonna go ahead and really take a peek. Oops, sorry. And no redness, nice cone, no swelling. The tympanic membrane looks good, no drainage, no bulging, so that looks fantastic. Now I'm gonna come from the left side. Come in from the side. And then again, and again, no swelling, no pain, no tenderness. Nice cone, no cerumen, blocking my vision. That looks fantastic. Great. The next part of the exam for your hearing is what we call the Weber test. It's just to check the conduction of hearing in the skull and the bone structures. So I'm going to go ahead and take my tuning fork and go from the top of your head. And I just want you to tell me if you hear this sound in both ears, one side, and we'll go from there. Okay. Go ahead and take my tuning fork. Ready?
both ears.
Okay. And tell me when you hear the sound.
Yep.
Okay, and we'll do this side. This is called the Rinne test.
Yep.
Oh, wow. Quick.
Yeah.
All right. So the next part of the hearing is the whisper test. Okay. It's going to whisper a word into the right side of your ear. And I just want you to tell me, I'm going to have you block the left side of the ear and let me know if you hear what I'm saying.
Dancing.
Right, and now I'm gonna have you cover the other side. And I'll whisper word in here.
Singing.
Great, excellent hearing, nice and clear. All right. Now I'm gonna move on to the nose. Any nasal congestion,
None.
any bloody noses,
Nose-
nasal
Those are
dryness.
great.
Nose is good, all right. So just looking from the outside, it looks nice and symmetric. Doesn't look like there's any contusions, any head injuries, skull structures or anything in the past. Nothing at all.
None.
All right, great. So I'm gonna go ahead and I'm just gonna press on one side of your nose. I want you just to breathe in and let me know if there's any stuffiness or congestion.
Nope.
All right, on this side. Okay, fantastic. I'm gonna go ahead and use my lidocaine. Just gonna look inside your nose and make sure I don't see any nasal polyps or cysts, bleeding, any broken bones, okay? Look up. Don't see anything. It looks nice and clear, no bleeding, no broken bone. I'm gonna look on this side. And nope, no bleeding, no broken bones, nice and clear. All right, looks fantastic. Great. All right, so now we're gonna go ahead and move on to the throat. So, yep, you know the next step. I'm gonna have you stick out your tongue after. I'm just gonna examine your lips. Any dried lips? No, they look pretty good given your eyes. I would expect them to be chapped, but they look nice and moist and no fissures or anything like that. And I'm just going to pull down on your lips. No aphthous ulcers. The gums look nice and pink. No excoriation. And then I'm just going to look up here. Again, nice and pink. And any dentures or anything at all? Okay. I'm just going to have you stick out your tongue for me. All right. Nice and midline. I'm not noticing any ulcers or any concerns on the tongue, any soreness at all.
Nope.
And just stick it out and look up for me. Like if you could stick it up for me so I can look underneath your tongue. Yep. Great. All right. right, everything looks nice and pink, the tongue is midline, and then stick it out, and I'm just gonna look at your throat. Great, go ah. Your tonsils look nice and equal, no swelling, no redness, nice and pink, everything looks good back there. Not noticing any exudate, any irritation or anything
No.
at all. All right, excellent. So lastly, I'm gonna move on to the throat area. I'm just gonna first of all check for any pain or tenderness, any nodules or lymphadenopathy or swelling of your lymph nodes. So I'm gonna go along the clavicular area in your neck bones. So we'll check along here and preauricular pain, which are any tenderness in the tongue areas, post-auricular pain, any pain or tenderness back there. Great. How about along your supraclavicular line?
No.
And your infraclavicular line?
No.
No pain, tenderness at all? All right, we'll go right behind the neck. Any pain, tenderness, not feeling any nodes or anything?
No.
All right, great. Now I'm gonna look at your trachea. I'm just gonna have you look up. I'm just gonna palpate your trachea and inspect it. Feels nice and midline, might be a little ticklish, so I apologize. Any tenderness at all?
No.
Okay. Any smoking or anything in the home?
No.
How about for yourself?
No.
All right, excellent. So the last part of the exam is just to examine your thyroid. This part can be a little uncomfortable, but it's a really important part of the exam.
Let's do it.
So I'm gonna go from the back and I'm just gonna palpate with my 4 fingers. I want you to let me know if you have any tenderness, but I'm gonna feel for any polyps or any areas that we might be concerned about. If I feel anything, we might consider getting an ultrasound and referring you to an endocrinologist, but hopefully not. It's just a routine part of the exam. Okay, excellent. All right, so I'm gonna come from behind, Mr. All of you just look up. And if you cough at all, this is perfectly normal. Everything feels good, no nodularities, feel perfectly normal and symmetric. All right, excellent. No concerns today. All right. Well, do you have any questions at all for me?
None, thank
All
you.
right, you're welcome. Certainly, if anything comes up that you start to experience any changes in your vision, hearing, loss of smell, I want you to give us a call. And we'll see if we can squeeze you in there.
Great, thank you.
All right, well, thank you for your time and allowing me to do this exam.
Sure.
It's so nice to meet
Yeah,
you.
you too.
So stay well.
Yes.